A very good morning to you all. First of all, I'd like to thank Rohit and Team NN for inviting me to be here today. And I'll also like to applaud their efforts in creating such an awesome platform. By doing this, they are not only upping their own game, they are making sure that we up our game as speakers as well. So truly applaud your efforts, Rohit, and all your fellows and the team. Thank you very much for organizing this. Now, I think we are all expert at conversation. How many of you here think that there is still a need, a desire, and a want of having better conversations with our patients? Okay, so we have a couple of hands here. So today my topic is the art of conversation. And of course, it's going to be a mutual dialogue. Our patients do not care so much about how much we know. They care more about how much we care for them. But the question is, how do we convey care? And why is it important to convey care? We are worried about the cure of the patient. Now, good thing is, cure and care are synonymous when it comes to patients. A lot of studies have shown that when a patient is cared for, the results of our treatments are much better. When there is a better conversation between the physician and the patient results are better than what we will even expect. Let's look at a study. This study was conducted in patients who underwent thoracic surgery. Now, typically, these are the patients who have a lot of pain after the surgery. So, patients were divided into two groups, and they were given IV morphine as part of their treatment. However, there was just one simple difference between the two groups. In the group 1, after they complained of pain, there was an interaction by the doctor. The doctor came to the bedside, interacted with the patient, had a conversation, understood what the patient was feeling. In the group 2, no such thing happened. And then in both the groups, IV morphine was given. Now, as you can predict, what would happen to the pain sensation in both these groups? As can be predicted, 80% of patients in group 1 experienced pain relief versus only 20% of patients who experienced pain relief in group 2. Now, the strength of the patient and provider interaction is not just restricted to such serious conditions like thoracic surgeries, but even to very mild, normal day-to-day situations. For example, there was a study that was conducted amongst the housekeepers of a hotel. Now, these housekeepers typically would work what would be akin to what an athlete would be working out in a day. However, they don't think they are working out. They don't think they are exercising. And what that means is that the mindset of that individual is that I'm not exercising enough, so I'm not healthy. So these people were divided into two groups, and they were shown the importance of exercising in their life. The only difference between the two groups was the group 1, they were made to understand how much they are exercising purely by virtue of the work that they were doing. And group 2 was given no such information. And all their parameters were recorded right from their body analysis to their blood pressures and their sugars, etc. And after a month, these analyses were repeated. And as was expected, in group 1, all the parameters showed improvement. And in group 2, the parameters were really same. So what exactly is happening here? It's the conversation, the information that the patient received, which brought about a change in the mindset of the patient. This change of mindset is what brought about these changes in our body. And this is what the conversation that the physician has with the doctor brings about the change in the mindset of the patient. And it's not just something which we see in the treatment, this is something which is seen in the placebo treatments as well. Whenever we are advising any form of placebo treatment, it is not the placebo, it's your relationship with the doctor, with the patient, it's the conversation that the doctor has with the patient, which brings about changes in the patient's brain. There is trust, there is faith, there is confidence in the patient's mind that I'm going to be all right, and that is what brings about that change in the patient's body. Besides that, of course, we all know that now we are extremely careful around litigation. There are numerous studies that have been performed around what causes patients to sue the doctors. In one study, it was found out that doctors who are sued more tend to spend 8 minutes less with their patients compared to doctors who are not sued as much. So what exactly is happening? the trust and the relationship that we build with an effective conversation with the patient makes the patient like us. When the patients like us, they do not sue us, even though patient may suffer a physical injury which may have stemmed out of our medical misjudgment. There was another study which was conducted on a group of patients who had actually sued their doctors, and they were interrogated and they were basically questioned that why did they do that. The basic theme that stemmed out from that study was, again, a lack of proper communication between the doctor and the patient. Patients typically had to say that doctor was not open to communication, they were not ready to listen, they did not give me the right information, they were hiding information, and they did not tell me enough about the long-term consequences and prognosis of the condition. This is what results in this kind of scenario where there is lack of trust between the doctor and the patient, and hence patients tend to sue their doctors. So, if we want to be sued less, we need to talk more to our patients. Doctors' assaults, violence against doctors, this is something we as Indians are seeing every other day, a new news about another doctor being beaten up. So what exactly is happening? Why is this happening now more often than before? Of course, our society has changed. There are a lot of multifactorial factors which are responsible for something like this. But more importantly, in a study that was published in Journal of Heart in 2016, it was found that a broken miscommunication between the doctor and the patient was one of the inciting factors for these kind of violence episodes against the doctors. A lot of times the physical and the emotional brutality of our profession, especially in the residents, we are harsh to patients, we don't talk politely to them, we don't entertain their questions. And this kind of lack of empathy is seen by the patient as a neglect. They perceive this as neglect. And oftentimes this perceiving of neglect is what causes patients to get angry and then resort to violence. So even if we have to avoid these kind of instances, sure, there are a lot of other factors, but one of the very important factors is to build confidence. Have that difficult conversation that you need to have with the patient. You need to understand where the patient comes from and have that conversation. And of course, very important thing is people who have extremely busy practices versus people who have not so busy practices. We all know of physicians who are extremely well qualified, extremely talented, and still you know that there is a huge difference in the way they practice and in the way their practice is popular among the patients. The single most important parameter which determines this is the interaction that the provider has with the patient, the relationship that they form with the patient, the conversation that they are able to engage in with the patient. Naturally, a lot of times we feel we are too busy, we do not have enough time to talk to the patient. But the basic premise of building up a busy practice is to actually form that relationship, to have that conversation. And one of the very important factors in this is that we take conversations, communications for granted. We do not think about it. And as a result of which, we tend to overestimate our own abilities of engaging in a meaningful conversation with the patient. There was a study that was conducted among the orthopedic surgeons. Orthopedic surgeons and their patients were surveyed to find out what they thought about the satisfaction of the conversation that they had with each other. And surprisingly, 75% of orthopedic surgeons felt that they had the result of that conversation that they had with the patient was satisfactory. Whereas only 21% of the patients felt that the conversation was satisfactory. In another study which was published in Annals of Internal Medicine, it was found that when the patient enters the doctor's chamber and start opening up their statement of concerns, they are allowed to finish that statement in only 21% of cases. In a more recent analysis, it was found that when the patient starts speaking, they can only speak for 12 seconds before being interrupted by the resident physicians. So what are we seeing here? We are seeing that we are in too much of a hurry. We feel that we do not have enough time. We feel that patients should not be asking so many questions. And hence, we tend to interrupt patients every now and then. And according to us, we are having a meaningful conversation with the patient, whereas according to the patient, we are not. We know the advantages of having that meaningful conversation with the patient, of having open communication with the patient, and still we are unable to do that. So what are the different aspects of having a meaningful and a good conversation with the patient? Let's look at the elements of a good conversation. Calibration. Now, calibration is extremely important because a lot of times we feel that conversation is all about just talking. So calibration is something that we need to do for ourselves as well as for the patient or people that we are interacting with. And these elements of conversation are true irrespective of whosoever you're talking to. You could be talking to a friend, a relative, a stranger, or your patient. Calibration involves three things: verbal, non-verbal, and paraverbal. Verbal is, of course, the content of your speech and the words that you're using. That's extremely important because through that you can explain to the patient what is the problem, what is the prognosis, what investigations, what treatments, etc. The second most important thing, which is actually even more important than verbal is actually responsible for just 10% of the communication, whereas 90% is by non-verbal and paraverbal factors. So non-verbal is your body language. What are your gestures like? How are you positioned? How is your body posture? What is your facial expression like? And what kind of spatial distance you're maintaining when you're talking to somebody? And your paraverbal factors are your tone, your pitch, and your volume. Now, if you can observe these factors in yourself as well as people who are in front of you, you can adjust and calibrate your own body. You can allow the shift of state in the patient's body by doing that, and that is extremely important. 90% of your communication is affected by these things. For example, if I'm standing like this and I'm saying, oh, you have a problem, versus I'm standing like this and I'm saying, you have a problem, versus I'm standing like this, I'm saying, you have a problem. All these things will convey a totally different meaning to the patient. So pay attention to your body language, to the patient's body language, and to the tone that we usually speak with the patient. Attentive listening. I think this is not new. We all know how listening is so important in a conversation. It is more important than actually talking. Now, when we speak about attentive listening, that means we are not doing any multitasking at that time. I remember one time I asked patient a question and I was also typing my notes at the same time, and after a few seconds the patient stopped and I was like, I'm listening, go on. And he's like, doctor, you're typing, why don't you finish your typing first and I'll speak after that. And I realized that yes, that's the right way, because otherwise patient will feel I'm not paying attention and I don't care. So a lot of times our patients are more perceptive than we think they are. They are interpreting every single thing. They're looking at us very closely. So it's important that when the patient is talking, when we are engaged in that conversation, we give 100% attention in that moment. Clean language. Now, clean language does not mean that we do not use vulgar language, which is obviously true. We should not use vulgar language. Clean language means open-ended questions. So we allow the patients to speak rather than asking them direct questions. Are you having pain? Is it causing problems? Etc., etc. So rather than asking the direct questions, which are also important, but in the beginning it's important to ask open-ended questions so that patient can actually come up with the real and the true information. And last but not the least is empathy. We all know how important is empathy in this relationship. If the patient is not going to understand, you really care, you really understand their problem, and you're there for them, everything else becomes ineffective. So empathy is the single most important factor which we need not just to train ourselves into, but also make sure that our young generation, which is currently under training, we deal with these cases day in and out, as a result of which, for us, these are normal routine. But we must understand that for patients, these are not normal routine. For him or her, that's a real problem. And we need to show that empathy to these people when they come to us. So I'll conclude here. And I have a mnemonic, which it's called LOT. So as you can see, listen attentively, observe, and then talk. Thank you very much for your patient hearing and kind attention.